Nice to meet you. So I understand that you have numbness and tingling in both your hands?
No, just the left hand.
Okay, just that one was
This one was
operated on,
already operated on.
and that's fine?
This one's been fine.
Okay, so how long has this one been bothering you for?
About 15 years.
Okay, so it's been getting worse recently?
Yeah, well, also my max out of pocket's met, so it's time to get it done. We had kids, all kinds of stuff in between.
Okay,
So it was supposed to be right hand heal, then get the left hand done.
I got you. And then kids got
Then,
away?
yeah.
Alright, have you worn splints and tried all the conservative
Yeah.
stuff?
I wear splints at night to keep the,
Okay.
I get the sleepy numbness thing.
Is it weak? Because I can see you
Yeah.
lost some muscle over here. Do you feel that?
I feel it like tingly when you do that.
Yeah.
Yeah.
As the fingers go down? Any pain here? Okay. Any pain here?
I can feel
You
it.
can feel it? Does this make your fingers go numb? Push here?
About right, go down a little bit, about right there.
Right there?
This is where it starts to
Okay.
tingle.
Alright, and no problems here, no neck problems?
No, sir.
You know? Let me see it hand real quick, I just want to take a look. See, it looks like an open carpal tunnel,
Yes,
and
sir.
there's no other problems with this. Seems like you are into superheroes and
Yeah.
cool, very nice. So it seems like you may have carpal tunnel syndrome, but you may also have a compressed nerve here in the forearm, the same nerve, but you seem to have a lot of pain right here. So I think a good next option is to do a nerve test. You haven't had one in a long time,
It's been about 15 years. Yeah.
and that's going to tell us how severe your nerve compression is
Mhm.
and the exact location. If it's somewhere in this area, it's considered carpal tunnel. So if it's a little bit more proximal or in the forearm, we call it something else, pronator syndrome. So, you know, it sounds like you failed conservative treatment, and that the carpal tunnel release may help you. First thing you would notice after a carpal tunnel release is nighttime pain usually goes away immediately, and then the numbness and tingling will improve, but that's not an immediate improvement. It could take up to 3 months to improve. But 98% of the patients we operate on see complete resolution of their symptoms within 3 months.
Good.
We're going to do a little bit different, the procedure. If we do the carpal tunnel release, we're going to do it endoscopically. So the difference is on your right palm you have a large incision here. We're not going to do that, we're just going to make a tiny little incision here and a tiny little incision there. And rather than cut the whole skin, we're just going to tunnel underneath, cut the ligament, which is causing the problem, without cutting any of the tissue above it. So the advantage is you don't need any stitches for the wounds. They heal within a week, and there's quicker recovery for you.
Yeah, this one took a little while.
Yeah, so that's the great thing. And even if you have a pinched nerve elsewhere, we usually do them through minimally invasive incisions, so we'll talk more details about that once we have the nerve results back.
Okay.
You have any questions for me?
Did they improved the nerve test from 15 years ago?
All I can tell you is we've had the same physician doing it for a long time. He's pretty quick and no one's actually died. So I think we're good to go.
It works for me.